More than 3,000 kilometres from locked down Melbourne, Perth nurse Justin Holland is preparing to travel to the COVID frontline.
Well, what happened in Melbourne and what's happening in New Zealand and everywhere could easily happen to WA. I think WA is in a little bit of a bubble at the moment. They need our help now, but who knows, tomorrow we might need their help. So it's only fair to help out.
The 24-year-old usually works in the trauma unit at Royal Perth Hospital. This will be his first trip to Melbourne.
Yeah, a little bit nervous, but yeah, I think that'll subside once I get to Melbourne. Seeing what's happening in Melbourne, I think seeing it firsthand will be a bit confronting, but we should know a bit more when we get there.
730 has learned more than 90 West Australian nurses have volunteered to fly across the country to Melbourne. Most will be deployed in aged care homes. Healthcare workers have also volunteered from Queensland and South Australia.
Obviously, there's a risk of catching COVID. I've kind of told my friends and family quite recently, so they're all a bit shocked, but they're very happy for me. Yeah, they're very proud of me.
Justin will spend up to 6 weeks in Melbourne. When he returns to Perth, he'll face a fortnight of hotel quarantine.
It is a sacrifice, but it's not just healthcare workers as well. It's all frontline workers. It's, people working in supermarkets, it's people working in pharmacies. It's everywhere, really. We're all in this together.
Just driving into work. Melbourne is dead.
The arrival of interstate reinforcements is welcome news for Melbourne nurse Emily Morris. It's Emily's first shift back in the emergency department at Royal Melbourne Hospital after recovering from coronavirus.
I've just checked the allocations for today and first day back in resus in the hot zone.
730 first spoke to Emily when she was in isolation last month. She's since noticed a big drop in her energy levels.
Physically, it's been exhausting. I'm so tired still. And the PPE is obviously uncomfortable. I don't know if you can tell from my face. It's definitely leaves its mark. I'm halfway through my shift. I'm tired, but it's been okay.
More than 2,700 Victorian healthcare workers have tested positive for COVID. State government analysis released today confirmed around 70 to 80% of healthcare workers who became infected during Melbourne's second wave caught the virus at work, with poor infection control driving the spread.
Of course, I'm concerned as the chief nurse that we are seeing the predominance of this infection with nurses, and so it's important we reinforce and support them. We're hoping to see from Victoria further information too about where they think they're seeing these breaches in infection prevention and control occurring so that we can try to prevent further outbreaks.
Midwives Sam Martin and Sarah Robson are also recovering from coronavirus. Even though they're testing negative, they are yet to return to work full-time.
I think it's going to be a long time before either of us are doing full shifts in the hospital. Knowing that there are still healthcare workers out there testing positive, it's always quite confronting for us.
After speaking with 730 in July, they took part in a Victorian government ad.
Think about who you love most in this world and think about them in ICU.
Shortly after it was filmed, Sarah was readmitted to hospital with severe symptoms.
To see her pain so out of control again, and to see her respiratory function to be so poor, it was, really scary.
Sam is also struggling in the aftermath of the virus.
So this brain fog, as I tend to describe it, it feels like you don't have that mental clarity on any level. It's a real struggle to get those thought processes firing and actually doing something productive.
After a long period of isolation, the couple were relieved to finally be reunited with Sarah's 2 young sons.
Seeing their little smiling faces and having them latch on and give us a massive hug and not let go for like an hour, those are moments that we'll carry with us forever, and that's been really lovely.
After flying across the country, Perth nurse Justin Holland touches down in Melbourne.
The facilities are really fantastic. I have no complaints whatsoever. We've got an excellent view over Melbourne.
He's settling into his new locked-down environment before he takes his place in the pandemic front line and the hard work begins.
It's very strict, the laws. There's an 8 p.m. lockdown. You can't be outside for more than an hour. I've had a look at the nursing home where we're going to be working as well. It's quite confronting and it's quite a sad thing that's happening here in Melbourne.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.